Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. We just heard from Scott Thomas talking about invocation during this holiday season, and now we're going to talk about
your Artefill study.
Okay.
Let's go.
This is interesting. I'm lucky enough to be one of 6 doctors in the United States who are doing a study on putting Artefill in the cheeks. This has been done for years. The reason that the study is being undertaken is that they want to get FDA approval for this indication.
Will they be the only
Yes.
filler with FDA approval?
Unless Radius is doing the study too that we don't know about, or somebody else is. But the point is, Artefill is well positioned to do this because it's the longest lasting filler on the market, so it makes sense. If you want to do a liquid lift to sort of stave off a facelift, you would do it with something that lasts 4 or 5 years, not with something that lasts a year or 2.
Artefill claims to last 2 to 5 years as it is. Okay.
Yeah.
Right.
4 or 5 years.
Okay.
Yeah, Radius is about 1.5 to 2 years.
Okay, fine.
Which is good because we're going to talk about, we put Radius in your jawline.
I seem to be an exception to all this because I love Botox, yet I eat that up like it's candy in my skin.
Yeah.
You just shot me up 2 weeks ago, it's like you almost didn't do anything.
No, you're not moving at all.
I am too.
We shoot me up some people take a lot of Botox. You take a lot of Botox.
So my results are not normal.
Anyway, let's talk about the study. What it is first let me just say that a lot of things are used off-label. For example, Botox, when it's used in the neck or around the mouth, that's off-label.
What does that mean?
That means the FDA has not approved it for use there,
but
everybody does it.
Yeah, very famous dermatologists do that.
Right. The reason the FDA hasn't approved it is because the studies weren't done. Very expensive studies weren't done for that exact particular indication. To put Botox right there, you have to do a study. It costs $50,000, $60,000. They're not going to do it.
What does that mean if someone has a bad result and they want to sue the doctor and the makers of Botox?
Then you look at what is the customary practice in the country, and if so many people are doing it off-label, then it's
there are. I mean, they're in every magazine. There's one dermatologist in particular who's famous for these things.
Right. Okay. So almost all fillers, when they get approved by the FDA, they get approved for the nasolabial fold because it's easy to study.
Yeah.
Right. And so now the makers of Artefill have thought, wait a minute, there is this trend towards going for a liquid facelift.
Right.
People who are getting away from a facelift, and we talked about this before, let's be the only product that can be FDA approved for doing the liquid lift.
Can they restrict it like that? Or, I mean, Radius and Juvederm and all of them, they can do that too if they want.
Yes, they can. But what FDA approval does is it proves to the consumer that this has been studied, that it's safe, and that it's not just being done because somebody in Brazil invented it and now we're doing it in the United States. This is a bona fide treatment to do a liquid lift with Artefill.
Okay,
and that's why they want to get...
Right. I love Artefill. We all know that. But I'm just saying that they are not... This is not going to... For people who love Radius and Juvederm and for those manufacturers...
Which we do also.
Right. We love them too.
Right.
But Artefill is not blocking the other companies from not allowed. Right.
Not at all. But they're being very smart to say, we're going to spend the money to show that we can do this in a safe way.
Everybody's going to do that.
And then it works well.
Yeah. When there's one, there's more. It's fine, and because abundance is a good thing.
Yes.
Okay.
So anyway, there are 6 centers across the country. One of them is right here in New Mexico, and I've already done it. I've already filled the study.
You did it this week.
I've already injected my allotment of patients, and it's really fantastic. I mean,
results
it makes
are awesome.
A wonderful change. In fact, you can come to my office. One of my office staff members has it. See how good she looks.
And what's her age range?
I'm not sure. Probably
she's over
45,
50.
Well, 45 to 50.
Okay, and so, for example, a point I was going to make about these liquid lifts is that younger people can do it. I'm about to be 39 this month, and I've been doing this liquid lift for, like 2 years now, almost, maybe a year, 18 months. And obviously, I don't need a facelift. I'm way too young. But I am noticing a little change in my face. I am about to be 39, so I'm almost in my early 40s, and at that point, your face does begin to lose its collagen and elasticity. So what I like is that women who absolutely would be thrown out from any sane plastic surgeon's office for asking for a facelift can go in and say, I don't want a facelift, but I do want some lift in my face. What can we do? I'd like a liquid lift. That's totally reasonable.
Right.
So it's actually helping younger people who are pre-facelift age to get the little lift they're looking for.
That's a very good point.
So yeah, so it's helping a lot younger women
Yeah.
achieve results that they have to wait for otherwise.
Another thing younger women want, and this is something that I'm doing with you, is facial sculpting.
Right.
It is actually,
I love it.
right. You know, somebody who's maybe was born with a flat cheek or small jawline who always wanted something bigger.
Right.
This is a way to do it. And
Right.
we
I
actually,
love it.
yeah, we gave you Radius because
I eat it. I eat it like it's chocolate, and for some reason it's a wonderful thing, and the results were awesome for me, and they're still there. I can still see them, people can see the results, but I really eat this stuff up. So we did Radius for me because we knew I eat Radius like it's going out of style, and the results wouldn't be very lasting in my face, and so if I didn't like it, then I would be assured that it would go away.
Right, and now we're going to switch over to Artefill.
We're going to switch over to Artefill
really
because,
great.
right, personally, I don't eat Artefill like it's going out of style. It just stays in my face, and it really, like all the fillers, it shows this awesome result. You should have seen me.
What we did was we
It's
put it right
awesome.
at the angle of your jaw.
Yeah,
And
I don't want Maria Shriver's jawline, but I was going for an accentuated jawline because I really don't have one. I have my mother's jawline, and so it's always irritated me. But anyway, so this is, so people, I'm telling you, and you know what, I told you this, what about people who want a slight neck lift? That does, or need the jawline, that little, we all get this, I'm starting to get mine, that little sack right under your chin area that starts to sag. That helps get rid of it. I think it distracts from it, or it lifts, it stretches out the skin or something. So facial sculpting, I've been harping on him for ever since he's gone into practice to do me, and he has been unwilling to until now. He said, "Okay, I'm comfortable doing it. I'm ready."
yeah, I know.
Yeah.
I mean, you know,
Okay,
it's
so-
not something that you want to go to anybody right out of the box.
No,
to do
I mean
it.
it was either him or Dr. Frederick Brandt in LA or New York. That's
Right.
it. I wouldn't trust anybody else.
Right, and I just didn't feel ready to do it. So
Yeah.
now that I've got, you know,
Yeah, no,
procedures
he's
under
awesome.
my belt, I felt that I could.
Yeah,
you know,
he's
I'm doing
awesome.
noses too, doing a lot of noses.
Yeah, he
the
fills in
non-surgical.
divots in noses and
You can lift a tip,
Can lift a tip.
with a filler, which is
Right.
nice.
It's
no doubt.
awesome.
And then
Yeah.
obviously the cheekbones, you know, to get that
Yeah.
Zoolander effect.
right. And you
People
know,
are
I
asking
took
for.
arnica one solid week before, and I had very, very little bruising, like one yellow spot in one corner of my jaw.
Right.
That was it. A little soreness, of course, and I couldn't, you know, chomp down on like granola for a couple of days, but you know, I softened it up and then I chewed it.
Right. Oh, I just forgot. I'm giving a lecture.
Oh yeah.
Yeah, I'm
This
sorry.
Wednesday,
This
we
Wednesday.
scheduled it
Right.
for the snowstorm.
I was going to give it last week at La Posada. There was a snowstorm. This Wednesday at 6 o'clock at La Posada. The reason I mention it is because we're offering great discounts, like 20% off any of these things,
Right.
such as facial sculpting procedures, whatever. La Posada themselves is giving 30% off any treatment book that night.
Oh,
and
that's awesome.
they're catering the event.
I
So
might come just for the free food from
Okay.
La Posada. That's pretty darn good right
6
there.
to 8 La Posada on Wednesday.
Right, and if
We'll
you're
see
out and
you.
about and you don't know quite what to do, please stop by the Chavez Center today until 3 o'clock.
Right.
We are having an adopt-a-thon from the Espanola Valley Humane Society. Lots of puppies, which we don't often have. We have lots of puppies available, a couple of purebreds, cats and kittens, of course.
Right.
So please come on by.
Okay, thank you so much. You've been listening to Talk 1260 KTRC.
Catch
This
you
is
next
the
time.
Humanity Behind the Vanity. We'll see you next week.
All right.